Hello there. Thank you very much for being intentional and staying with us since the 8th of March till today on this first annual Gender Equality Conference 2021. And this conference is running under the theme Women in Leadership and how we can be able to achieve a gender equal future in COVID-19. My name is Patricia Kajumba. I am a social worker based in Uganda and also the founder of the Twekonyere Foundation Uganda. This is an organization that is working towards achieving complete menstrual health and hygiene for young girls and women, especially those living in rural communities. As a young woman in leadership, it's my pleasure to be speaking to you on this She Talks Dialogue, a space that is bringing different kinds of topics together, bringing different kinds of uncomfortable conversations to on board to see that we can forge a way forward and have a future that is gender equal. The She Talks Dialogue today is under the theme Mental Health, COVID-19 and Gender Equality. And in the next few minutes, I'll be speaking about the impact of mental health towards achieving gender equality in Africa. Before we dive deeper into our conversation, I would like us to remind ourselves about the definition of mental health, especially by the World Health Organization. Mental health is really a state where each individual is able to realize their capacities, each individual being able to cope with the normal stresses of life, each individual being able to work towards the development of their communities. And speaking in that way, it also calls upon us to speak about the context in which we are in today, especially as African communities, as women in leadership in COVID-19. COVID-19 came as a totally new thing to us, especially here in Africa. Governments and leaders were not really ready to handle this pandemic. This therefore called for different measures to be put up to stop the spread of this pandemic. And I would like to mention that really these measures were good, but also caused a very huge and enormous impact, actually negative impact to our young girls and women here in Africa. Some of these measures included total lockdowns. We had this intervention being put up to stop the spread of this pandemic, but it also caused a number of negative effects to our young girls and women. Just to mention but a few, the total lockdown really led to a discontinuation of access to services and different kinds of access to information that helps young girls and women to be able to make informed decisions, to be able to make the right choices for their lives, especially their sexual and reproductive health choices. We also saw the suspension and closure of schools, which exposed our young girls to more risks towards their mental health and ability to cope in society. One of those risks being child marriage. In our communities, we saw a number of young girls being married off in exchange for money, in exchange for food, in exchange for different kinds of materials. There has been an increase in violence towards women and young girls. You can mention the different kinds of violence. We have seen sexual violence on the increase, physical violence on the increase, emotional violence, financial violence, etc., and you can name it all. Because of COVID-19, we saw a decrease in income generation activities, which implied that for women who have triple roles to play, that is to say their reproductive roles, their productive roles, and community roles, had an enormous pressure put on them, because for all these roles to run, especially today, calls for financial stability. But that was no more when the pandemic hit Africa. We also saw that there was an increase in different kinds of um, inequalities towards women and young girls. The failure for them to be able to go to different kinds of spaces and engage in different kinds of activities that were developmental meant that there was now an impact on their socio-economic well-being and also being able to run their lives effectively. Therefore, the pandemic and the crisis that it caused had an impact on the mental wellness of young girls and women. And today, as we speak about taking stock, as we speak about leading the way and building the future towards gender equality, I certainly believe that mental health is one of those factors that is going to contribute towards us achieving gender equality. And why is that so? It's simply because when women in leadership are mentally well, they will be able to feel confident. These women will feel in control and therefore make informed decisions. These women will be able to build and maintain good relationships that will serve the purpose of them having access to different kinds of opportunities. When women and girls are mentally well, it implies that our societies will be able to thrive in all the different kinds of triple roles that women play in society. Therefore, going forward, even after this annual conference, let's look at interventions that promote and push the agenda of mental health here in Africa. Some of the interventions that we should look at is creating communities and spaces that support the mental wellness and having conversations about mental health. We need to also look at promoting socio-economic activities where women can engage themselves and be able to boost their incomes going forward. We need to look at having different kinds of stations that offer different kinds of services even in hard to reach areas, such that even when pandemics such as COVID-19 or any other pandemic that could ever occur in Africa, we are able to have women and girls having their mental state being supported, because we can never imagine the kind of impact that COVID-19 has put on the lives of these young girls and women. Mentally, physically, emotionally, it has caused a lot of damage towards them being able to pursue or even run their own lives. So, as activists, as leaders in our different capacities, it's a call, it's a time to challenge ourselves and think about mental health. We need to think about why mental health is not prioritized in our programming now. Is it because of the norms? Is it because of the beliefs here that are in our African context? We need to have those questions really running through our minds, because it's clearly not possible for us to have a future that is gender equal if we do not have women and girls who have mental health or mental wellness in their lives. So this conversation about the impact of mental health towards achieving gender equality really speaks into us building towards a future that has women who are able to peak on their capacity, women and girls who are able to realize that they have dreams that they have to pursue, women and girls who can cope up with the normal stresses of lives, We need to have women and girls who can be able to work productively and therefore contribute towards the development of their communities. Um, just to conclude by saying that African communities can be able to achieve gender equality if they also consider factors such as mental health. Because from mental wellness, we shall be able to have different kinds of other achievements coming through for our young girls and women here in Africa. Thank you so much for listening and staying with us during this first annual Gender Equality Conference once again. And I am wishing you a happy Women's Month and reminding you that if you're a woman out there, you are enough, and you will always be enough.